Good morning. Welcome to another edition of Lee Pitts Live. You are looking live at Hope Healthcare, the preeminent hospice healthcare full service organization in all of Southwest Florida. We're so thrilled to come to you with Lee Pitts Live, who will be coming to you for the next 4 weeks from this fabulous location where the accommodations have just been outstanding. Special thanks to their CEO, Samara Beckwith, and their marketing director, Amy, for doing a yeoman's job of hosting Lee Pitts Live here. We have a fabulous show in store for you today. We'll get a chance to talk to Dr. Antonucci, the CEO and president of Lee Health, who will give us the state of Lee Health. Also get a chance to talk to Trish Rout, the coordinator for Southwest Florida's Crime Stoppers. All that's happening on Lee Pitts Live. We'll be right back. All right, Southwest Florida, welcome back to Lee Pitts Live. Again, we're here at Hope Healthcare, where the accommodations have just been outstanding. We have the CEO of Lee Health here. Let's bump him in, Larry Antonucci. Larry, welcome to Lee Pitts Live.
Thank you very much.
Happy holidays.
Thank you. Same to
Larry,
you.
last year this time, during the holiday season, the state of the COVID situation, I can't remember, I'm sure you keep up with that. Where were we then and where are we now in terms of your hospital and the state of the COVID situation?
Well, we were much better off than we were a year ago. You know, we had a significant surge. We had a number of surges. The last surge was, of course, the worst, where we were admitting 80 to 100 COVID patients a day. Truly remarkable. Now those numbers are down in the single digits. We have about 25 to 35 patients in the hospital with COVID. We're back at our peak bed over 600.
That's
we're
great.
Seeing a definite reduction due to the vaccination that's been going on. A number of our citizens have been vaccinated, and it's been very effective in preventing people from getting very sick and winding up in the hospital.
Well, I'm proud to say me and my family were vaccinated. I'm in process of now getting my booster shot, and I'm going to follow all the CDC and anybody else's guidelines. How about that?
Yeah, good for you. Good for you.
So I encourage everybody to do so as well. We're going to talk broad picture Lee Health, but I want to book in a couple of things. Now with the COVID situation sort of down, I know you're still paranoid. You don't know if you could get a spike again. Now I see that you guys are able to move into more of your general surgery type things too. Now the hospital's sort of function like normal. That's a big help, right?
Yeah, without a doubt. There was a period of time where we had to stop all of our elective surgeries, but now we are back to full operation. We're doing elective surgeries. Our offices are open. So yeah, we're serving the community as we have for more than 100 years.
That's great. The spotlight, I mean, from my being around you these past years, you don't seem like a person who craves the spotlight, but it seems like you were thrust into the spotlight nationally and locally. How was that for you, like socially, mentally, and everything, to be thrust out there giving these updates and stats all the time?
Sure. Well, one of the things we recognized very early in the pandemic is that there was a tremendous amount of misinformation out there, that people were saying things, there were things on the internet that just didn't make any sense.
Gotcha.
And so we felt that one of the main functions we had, in addition to caring for thousands of patients, was to be a source of truth. So as a result, we felt it was important to have regular media events. And so we did press conferences once a week where we talked about what was going on and we just answered questions. We also did town halls. Everything we could to get the information out there to the public. It's not something that we, as you said, looked to do or wanted to do, but felt it was something that we had to do. It was part of our duty, and we did it, and I think it really helped. We got great feedback from citizens through both our media events and our website, where they felt that there was good information that they could count on.
Because every morning I would get up and whether I saw it, a video or I saw the writing in the newspaper, I was constantly looking and tracking, and I was like, they're constantly giving me information in a Sesame Street way. I understand everything, and I was able to just keep up with it. Having said all of that, Dr. Larry Antonucci, what is the state of Lee Health as we sit?
Lee Health is doing very, very well. We had an excellent year last year. We were able to, while managing COVID and doing all those things that entailed, maintain high quality and also plan for the future. I think that's one of the things we're very excited about. We couldn't just sit back and be totally consumed with COVID. We actually had to continue to do the strategy and the planning to get us ready for the next 5 to 10 years.
And I think I read somewhere that financially you came out very well in this whole process, but it wasn't because of funds that you received, government funds or something for COVID. Unpack that for me.
Yeah, that's right. If you go back to 2020, that was the year that we had significant financial challenges, where we finished the year basically with no operating margin. And after we pay all our expenses, what's left is what we invest in the community. We're a nonprofit public entity, so every dollar we take in from patient revenue, we pay our nurses, pay our staff, and what's left we use to build things like the Children's Hospital or the Advancing Gulf Coast Hospital, et cetera. So 2020 was a challenging year. This year we did much better. Our volumes are up. We were able to maintain our costs. We had a whole financial recovery plan in place. But we didn't get any federal money in 2021. That was all restricted to 2020 from the CARES Act. So yeah, it was based on just tight operations, cost savings, and high volumes.
You decided to build a new hospital.
Yes.
I think from what I read, which really prompted me to say, hey, we need to have that conversation. The old, what we know today as the old Lee Memorial on 41 is going to be closed, or something that's going to be moved some years from now. Walk us through that.
Sure. So we recognized that we really needed to continue to serve the Fort Myers downtown and midtown communities, and we wanted to make sure that we had a state-of-the-art facility in that region. The challenge with the current Lee Memorial facility is that it's 50 to 60 years old. There are some real structural challenges in the ability to put in real high-end equipment in there. Floor-to-ceiling heights are kind of low, things like that. So we knew we had to do something different. So we were able to secure 52 acres right on Colonial and Challenger and Winkler to build a state-of-the-art facility. So we're going to be working on that over the next 5 years. Now in the interim, Lee Memorial Hospital will continue to operate as it is now. In fact, it's going to be converted to an all-private room hospital, which is something we've wanted to do for a long time. So once the trauma center moves out in January, Lee Memorial will continue to be a medical surgical facility. It'll continue to operate for 5 years, and then we will plan for that site as we begin to build the site over on Challenger. So what we want to do is work with the community, work with community leaders, work with the city of Fort Myers to say, okay, what would be best for that site? What type of health care resources do the community really need? And that's what we're going to be doing.
So the goal is for that site to still be healthcare related. No condos are going to go up there. That could be a possibility too, right?
I don't think so. I mean, our focus is going to be on healthcare.
Right.
Now again, excuse me, as we work with the city leaders and the community leaders, we're going to assess what they feel it needs. Is it possible that they think that affordable housing might take up part of that space? It's possible.
Right, that's good
but
use.
Our focus is going to be on healthcare.
Now, what do you say to the cynics who say, hey, when you take Lee Memorial Health, the old Lee Memorial from here, that's the closest hospital to the African American community, the minority community, Dunbar, East Fort Myers. Now we got to go to the Daniels, I think he said?
No, Colonial and Challenger, yeah.
Colonial and Challenger. They don't necessarily have to go there. There are other hospitals all around too. You got your Cape. Go ahead and walk us through that.
Well, one of the things that attracted us to this particular piece of property is that it actually affords better access to many of the underserved community. It's 5 miles from our Dunbar federally qualified health center. It's 5 miles to Lehigh Acres. It's closer to East Fort Myers, the whole Ortiz corridor, and it's 2 miles from I-75. So we think the access will actually be better for the underserved communities.
Yeah, psychologically, people don't think about it that way. I'm glad you summarized it in that manner. You mentioned Children's Hospital early on. Of course, I've taken my television show out there and done some great things there, and it's just a fabulous facility. Are there any major changes in the Children's Hospital since COVID or since the last time I was out there visiting that fabulous facility?
Well, thankfully, one of the things we've seen is that although COVID has affected children, it hasn't affected them in the way that we've seen in the adult world. So in any given day, we will only have a few kids with COVID, so it hasn't been a big impact there. That hospital continues to operate. It operates wonderfully. No major plans for expansion right now. It's meeting the needs of the community. What is exciting, though, is that we're adding new services. We recently just started neurosurgery at the Children's Hospital, which is really very, very important because in this community, if a child falls off a playground and hits their head, many times they would have to be transferred to Miami or Tampa, even for observation, because we didn't have neurosurgical services.
Really?
But now We have neurosurgical services in partnership with Johns Hopkins All Children's in St. Petersburg. And that'll allow a lot more children to stay close to home if they suffer any type of head injury or need any type of neurosurgical intervention.
Now, if I'm not mistaken, the Children's Hospital here is the only children's hospital for maybe a 300-mile radius or something like that?
That's right. It's the only children's hospital between Tampa and Miami. So it's been such an important part of this community.
Yes, sir.
Whether it's trauma care or cancer care, especially when you think about what would happen to a child diagnosed with a leukemia, for instance, and having to travel 2-3 hours every week for therapy, and having all those services right here has made an enormous difference. And the outcomes are as good as any major cancer center.
Wonderful. Early on, you mentioned that the old Lee Memorial Hospital, still, I keep saying old, but it's so historic. It's going to be like private beds, you said. What does that mean to the layman?
Well, when the hospital was built back in the 50s and 60s, one of the standards was what's called semi-private rooms, where there were 2 patients in a room. And so over time, we've tried to convert that, but it hasn't been a complete conversion. But now in January, with moving to the trauma center, all the rooms will be private rooms. So there'll be 1 patient, 1 room. So you won't have to share a room with anyone else. I
see. The new hospital, I'm assuming it's going to have all the bells and whistles in terms of state of the art. You talked about and you've been building healthcare facilities for a while now. Over the past 15 years, I've seen retrofitting and all that go on. All of the things you've been able to learn from those experiences, along with new technology that's coming in all the time, it's fair to say that all of that would move into would be a part of this new hospital?
Yeah, that's right, Lee. One of the advantages to doing this is being able to start with a blank sheet of paper and really designing the hospital to be patient-centered. So, of course, all the rooms will be private. There'll be 216 beds with an emergency department. We're going to have observation beds. We're also going to have an office building there, and we're moving our data center there too. So all of the computer stuff will be there also.
What's the name? Do you have a name for it?
We don't have a name yet.
Okay.
Yeah, we're gonna
but I noticed you named the whole healthcare facility Lee Health.
Right.
Thanks for naming it after me.
Well, that was very
Don't
intentional.
take my name off of it.
That was intentional.
Every time my son sees it, Dad, that's named after you. Yes, sirree.
Well, I wanted it to be Lee Pitt's Health, but they voted me down.
Boy, I tell you, Mom would be proud of me. Let's talk about the morale staff. How many people work for Lee Health, and how is that morale now coming around now?
Sure. We have about 14,000 staff members.
Is that the largest employer in Southwest Florida?
Yeah, it is. And 4,000 volunteers too, which we're very, very proud of. The community has really stepped up to help us, and a medical staff of about 2,000. So we've got an incredible staff. And what's been most remarkable in watching them through this COVID pandemic was their resilience, their ability to innovate. If you remember early on, it seems like it was ages ago, but back when this pandemic hit, we knew very little about this virus. We didn't know how it affected folks. Our staff didn't know how it would affect them, how it would affect their families. I mean, we had nurses sleeping in their garages because they were afraid of spreading illness to their family, getting hotel rooms, etc. But they showed up every day. I mean, their resilience, their commitment, their dedication was awe-inspiring to watch that. And I'll just never forget being part of that and being so proud of the way this team stepped up. And even, at its worst, when we had over 600 people in the hospital with COVID, they were there every day for them. And they were not only there as caregivers, but they were there as family members. Because, as you probably remember, we had no visitation in our COVID units. We had to keep people out. So many times our staff members had to act as family too, and it was truly, truly remarkable.
Early on, we talked about the expansion in the new hospital and all the bells and whistles and the good location it's going to be in terms of the freeway and everything else. Any other expansions planned for Lee Health?
Yeah, we're very excited about our plans for Cape Coral.
Oh, really?
We're going to be doing some things there. We're going to be expanding the ICU, expanding the emergency department. And something that's very exciting is that we're bringing a internal medicine residency program to Cape Coral Hospital. So we're going to be training doctors there. And so this is very, very exciting. As you know, we've got the family practice residency at Lee Memorial Hospital. but we felt we wanted to do more than that. So we're going to be having a training program for new medical graduates at Cape Coral Hospital. So
they will be coming in from anywhere in the country?
Yeah, anywhere in the country. So we'll have 12 new doctors a year coming there to train, doing a 3-year program, and then going out into practice. And hopefully we'll be able to keep a lot of those doctors in town.
That's what I was going to say. That's a good recruitment process as well.
Absolutely, yeah.
Speaking of recruitment process, I don't know how that gets to you, but of course we've been reading in the news about how during this pandemic, the healthcare providers' cost seems to just be cost gouging in some places.
Yes.
They're charging so much, and travel nurses and all of that. I'm not going to get too detailed on it. I'm going to let you speak to that.
Yeah, one of the things that we face when we see big surges of patients is the need to bring in what are called traveling nurses. And these are nurses who work around the country based on where they're needed. And they're brought to us through agencies. And one of the things that we've encountered, unfortunately, during the pandemic is the cost of these travelers has increased dramatically, and in many cases almost doubled. And I'm sure part of it is supply and demand. But I know that the state government and the federal government is actually looking at whether some of these agencies have been raising prices inappropriately.
There are laws against that?
Yeah, there are.
That's about as much as you want to say about it?
Yeah, and if there aren't laws, there should be laws. Let me put it that way. Yeah. Something else, Lee, about Cape Coral I wanted to mention too, is that we actually are working on some property on Pine Island Road to put up a facility there that will look like our Coconut Point facility. I don't know if you're familiar with that, but it's a large outpatient facility with doctor's offices, an emergency room, lab, x-ray, et cetera, on Pine Island Road. Also.
Is that considered more of a satellite concept, or is that like full service?
Yeah, let's put it this way. It's like a hospital without inpatient beds. So it has everything that a hospital would have, but we don't keep people there for days. So we'll work overnight and then let them go home, or if they need to be hospitalized, transfer them to one of our hospitals. But many of the other things that you need, probably 90% of what you need in healthcare will be able to be done there, whether it's lab work or x-rays or rehabilitation and therapies, et cetera.
When you talk about these expansions, what does that say about growth in the area? Are you moving as it relates to the high percentage of growth in population as well?
Yeah, we have a whole team that looks at that is studying the population patterns and how much we're growing, what the use rates are in healthcare so that we can build appropriately. You know, we've been a part of this community for more than 100 years, and as the community has grown, we've grown. We've grown from a 4-bed little hospital downtown to now one of the largest public hospitals in the country. So we constantly have to look at that and watch where the population is, what the demographics are, and meeting those needs. I'm
glad you mentioned that, because this is one of my comeback questions as I was continuing to listen to you talk about these wonderful expansions. How are we in the state of Florida in terms of size? You mentioned public hospitals. You get compared to public hospitals. Is it fair to say we are one of the largest, or the largest public hospital system in the state of Florida, and then maybe in the Southwest region?
Yeah, I know we're one of the largest public hospitals in the country, actually. The last time Modern Healthcare, which is one of the healthcare magazines, published it, we were the 4th or 5th largest in the country, and certainly the largest in the state. So, yeah, I mean, we've had to grow with this community, and we've done that, and we will continue to do so.
There are organizations out there that rate hospitals. I wouldn't be smart enough to remember all the names, but I read about them. Talk about ratings, how Lee Health is rated, and what you're most proud of.
Well, I think what we're most proud of is our continuous focus on quality. You know, we've seen there's companies called Health Grades and Leapfrog, and of course the Medicare program rates, and all of them are a little bit different, and they all look at different things, but we've consistently been at the top of those ratings or near the top of the ratings. But our goal is to continually improve. We don't rest on our laurels if we get a great rating from anybody, because we know that we could always be better.
And what's your plans as a CEO and a president? You plan to be around many years to come, or what's going on with you?
Well, I'll be around as long as the board wants me to be around, and as long as my wife lets me be around.
Because I see, like, you could have gotten burnt out just now, man.
You know,
you've done 10 years work in 2 years.
You know, I haven't done it. The staff has done it. Trust me. They're the ones that are in the front lines, dealing with this every single day. But it's been challenging. There's no doubt. It's been challenging for 2 years, but it's also been inspiring and enlightening.
Well, Larry, it's been a pleasure to get you here. Dr. Antonucci to give us the state of Lee Health. Look forward to getting you back later on in 2022, okay?
Yeah,
Stay right there. As the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like Dr. Larry Antonucci and all the fine people over at Lee Health. And of course, Miami has the oranges, but Fort Myers got the
juice.
We got the juice. We'll be right back.
Lee Pitts Live is a Lee Pitts Enterprise production.
Hello everybody, this is Lee. I'm so glad that you watched that particular show, and if you enjoyed that show, we got other shows like that. Just subscribe to our YouTube channel, watch Lee Pitts Live on demand anytime, and also hit us up on all our social media platforms. Just type in Lee Pitts Live, and there you go.